one that didn't seem possible a year ago as we entered into the pandemic.
Para terminar esta
so many
pandemia,
unknowns, so little defense
muy
against
pocas
a new
defensas
virus that
hubieron
was
contra
wreaking
este
havoc
virus
not only
hace
here,
tiempo
but obviously across the world.
y a
And we're
nivel
here today
mundial.
with some good news. I'm going to be
Pero
joined
tenemos
by
noticias buenas
a
ahora.
familiar face in Commissioner Jan Malcolm of the
Los
Minnesota
comisionados y
Department of Health,
ejecutivos que
and
están
then another,
trabajando directamente en
familiar
este
face to
propósito y
you,
objetivo
Dr. Abe
nos
Jacobs
brindan
of,
buenas
mHealth
noticias hoy.
Fairview. And Dr. Jacobs has been what
El
we've done
doctor
all
Jacobs
along
ha
in this,
estado
listening to the
trabajando
experts, listening
incansablemente,
to
liderando
the
la parte
science,
médica, la parte
and making
científica,
sure that as we were putting protocols in
para
place, we were
poder
understanding what the
establecer
real-world
protocolos y
implications of those
restricciones,
were, how it would
regulaciones
impact
que nos
those
ayuden
providers,
a
how
poder
it would
manejar
impact,
esta pandemia de una
the
mejor
health
manera
outcomes that we were trying to get. And,
para poder
I'm just
conseguir las metas
incredibly
que
pleased to
queremos.
be here, with you today and say a thank you to
Es
all
un
of you.
privilegio estar enfrente de
Minnesotans are
ustedes
doing
hoy
what
y
they
poder
need to do. You
compartir estas
continue to wear
noticias.
masks, you continue to social
Les
distance, you
continuamos,
continue to
les
look out
pedimos
for
que
each other. And right now,
observen
the
los
two things that are
distanciamientos
really
sociales,
important, you continue to
continúen
get
observando
tested,
las
to make
reglas que
sure
se han
that you don't
establecido,
have,
lavarse las manos,
COVID, and if
el
you do,
utilizar el
put
cubreboca, la
protocols in place.
mascarilla,
And
reglas
right now,
esenciales
the
que
thing we're here to
ayudan
talk
a
about
salvar
is
vidas
vaccinating. And
hasta la
as you can
vacuna.
see on the opening slide, we're here to end
Como
this
podemos ver en
pandemic.
el
We are on the
gráfico
doorstep of
siguiente,
doing this. We're not done.
no hemos
The analogy
terminado
we used
aún,
is a
hay
few
mucho
nice
que
days
hacer.
does not make spring.
Estamos en el inicio de la primavera. En los días mejores se avisora ya mejor tiempo. Un par de cosas para recordar que nos van a ayudar a liderar el vacunamiento, la inoculación. Los lugares de distribución que se están presentando, que están ayudando para este objetivo, en el que millones y millones de venezolanos podrán recibir la inoculación. Lo que esto significa es de que nos vamos a tener mayor amplio frente de resguardo contra esta bacteria.
It had many levels of where you could get the vaccine from, and we were focused on the things that mattered. We were focusing on vaccinating for impact and health impact. That meant getting the healthcare workers in line. It meant making sure our seniors were in line, our long-term care facilities, critical workers, those with underlying health conditions, the things that we knew would vaccinate and take down the death tolls and would reduce the number of people ending up in hospitals. And at this point in time, Minnesota, we're leading the nation with 80% of 65 and above taking this vaccine. That's the entire population. I'm sure there's some of you and some of your relatives who are still down south, and we're getting the folks. Continue to get those vaccines, and over 66% of our educators and child care workers, which has enabled us to get over 90% of our students back into in-person learning while protecting those folks, both the teachers and the support staff around them in schools. This is a phenomenal numbers. These are things that wouldn't have happened without all of your help. These are things that would not have happened without having a very robust vaccination ecosystem. We built this thing, as the saying goes, skating to where the puck was going to be. And the puck is coming next week in the form of a dramatic increase in the number of vaccines that the federal government is able to deliver. I spent some time last week not only with the White House, but with Alex Gorski, the CEO of Johnson & Johnson's, explaining this process. And I just want to be clear, this is some tough science that's going on. It has been researched for years, and it takes some patience to get these things out. And that's why in the beginning, in December and January, everybody's, where are the vaccines? Where are the vaccines? They're in the pipeline. They are now coming, and we're going to see that next week. Because of that, the news that I think all of us have been waiting for, all Minnesotans age 16 and above will be eligible next Tuesday, March 30th, to receive their vaccines. I can't tell you how excited I am for the state of Minnesota. I can tell you that we have built the infrastructure, both the tech infrastructure, but more importantly, the distribution system to get vaccines out. To use our analogy, we created a lane, and that initial lane was to take care of folks in long-term care and our health providers who are on the very front lines of this. And then we started to add more lanes to that freeway. The freeway is running nearly at full speed, and on Tuesday it will. But I want to just be very clear. That fast lane on the left is still for seniors 65 and above. And as long as someone's in that, they are being prioritized to get that. But what this allows us to do, and with the number of vaccines the state of Minnesota is getting, if no one's in that lane, our providers will move to the next lane. If no one's in that lane, they will move to the next lane. And what we want to do is we want to keep the queue loaded so that we go for that goal that we need to get to, 80% or above of our population vaccinated, to get that immunity that we need to truly turn back to all of the things we love so much. So this was a modification of the chart we showed you, and I told you at the time about 6 weeks ago that timeline could move to the left, meaning it could move sooner, dependent on what the federal government was able to do. And at this point in time, each and every week, the federal government has been able to give a little bit more of an allotment, and now we're going to see next week an even bigger allotment. Now, I want to just caution folks, as Mr. Gorski at Johnson & Johnson said, this isn't building widgets. This is nature, and it takes some time to grow these vaccines, to validate these vaccines, to package these vaccines, to get them to the states and get them in arms. Now, the good news is when they get to the state of Minnesota, they get out faster than any place in the country. But we need to understand, we need to take a little patience. This isn't an absolute guarantee, but we're confident enough now with the supply chain that is coming from the federal government and our distribution system that we need to load all of these queues with folks in it. Now, I would caution, and Commissioner Malcolm will caution, you'll probably hear Dr. Jacob caution you, this does not mean you're necessarily going to get this next week. It means you're in line. And we'll talk to you about, if you haven't done it, go to that connector website. Get your name in there so that you'll get notified. You may get a call from a local pharmacy. You may get a call from your doctor. You may hear that there's a state vaccine clinic near you and it's open for anyone for appointments. Stay on top of that. Help others who don't who might not know how this works. Help a friend do this. You now have the opportunity, if you look at this, those priority groups are still going. Most of the ones on the far left, health personnel and long-term care residents, those are done. But if there's still a few in there, maybe they were hesitant to take it in the first place, they are still prioritized, and you move to the next. Pre-K and educators. We know they're still out there to get that. It's just simply that demand is not as high. So what we're not going to do is stop and wait till one lane stops dead and then add another lane. We're just continuing to add on, and that's what we've done. So for those of you out there now, families, you can go together and get everybody vaccinated. I would make an appeal to where we're seeing some of the highest spread happening in our younger people. Take your roommates and go and get the vaccine. Keeping in mind, there are no barriers, there's no costs. You don't have to answer the questions about this. I just want to make sure that you understand when you get the vaccine, not only are you protecting yourself, you're protecting that roommate, you're protecting that family, and you're protecting the person who might inadvertently get it through asymptomatic spread. This is how we break the back of this pandemic. And so, these vaccines are coming. We're quickly getting doses out. We know that more are coming next week. That allocation is there. The good news is, Minnesota, we built a system that can absorb a large number of vaccines coming into the state of Minnesota and can get out quickly. But again, vaccines and vaccines on the shelves do nothing. Vaccines in arms are how we beat this thing. So this is your opportunity. If you haven't done it, I hope you're going onto that website right now. Get on the Minnesota Connector, get signed up. If you contact your local health provider, think if your local clinics or your local pharmacy, there's all kinds of opportunities. We are expanding, as we did this week, into Mankato and other areas, state-run sites. Right as we speak right now, Lieutenant Governor Flanagan is down in Worthington, where over the last week, we have vaccinated tens of thousands of those critical workers in food processing plants and taken it right to them. And we're continuing and will continue to work with our business sector to make it as easy as possible to bring in these vaccination sites, to work with them, to make sure that people can do this as easy as going to work and getting that shot and being able to continue on. Those are all things that we need to continue to do. We've got a ways to go, obviously, to get to 80%, but the infrastructure is there. The vaccines are coming. Minnesotans are showing a willingness to get this done, and this is how we beat it. We couple getting the vaccine with just the basic protocols. Continue to wear your mask. I think all of you saw here 2 weeks ago, I was exposed and people at an event were exposed, Commissioner Malcolm and others, to an individual who, again, it's many cases no fault of your own, contracted COVID, but knew to get tested, knew to alert folks at that point in time, and then the system kicked in where the COVID Aware app notified people who might have been next to that person for 15 minutes within 6 feet, and then we were able to notify others who were in the vicinity. And I'm glad to say, as I walked out of my home today for the first time in 10 days out of quarantine, not a single other person was infected by that case. That's how you beat COVID. It has no opportunity to spread, it has no opportunity to create a variant, and it gets stopped dead in its tracks. None of those things stop. We have the most robust testing system in the country. Use it. It's free, it's easy, it's right there. If you think you got a sniffle, you think you might have been exposed, you think, you know what, I haven't been tested in a week or so, I'm gonna go down and do it. That act and then the subsequent protocols afterwards is how we beat this. Had we done this and had the capacity last year at this time, we would not see 500,000+ people dead. We would have not seen tens of millions of infected, and we could have ended this thing sooner. Now we have that protocol, those resources, coupled with vaccines. This is the sprint, Minnesotans. We have to outrun those variants. We have to stop the spread that's out there, and Minnesota is one of the states where it is gaining. But the good news is we're countering it with an aggressive vaccine effort. And so it's a great day, Minnesota. It's a good opportunity for you to get in line. We're beating the federal guidelines by over a month. Again, we're leading the nation in getting these things out. Minnesotans are leading the nation in willingness to take the vaccine. And now we're continuing to think about creative ways to make sure that equity is a part of this and making sure that we take it, in some cases, right to people's homes to let them get the vaccine if they have barriers to getting that. And I just want to say, of a year of hard work, of a thoughtfulness that went around when we heard the vaccines were coming in December, of building a system which we understood would take folks to watch and see what happened with this system that we built around vaccines, knowing that, and we said the day, when we have enough vaccines to vaccinate everybody, we need to be ready to go on that very day that we hear that. Well, that day has arrived, and a large part of that thanks goes to Commissioner Jan Malcolm of Minnesota Department of Health. Commissioner Malcolm.
Well, thank you, Governor. Good afternoon, everyone. Or good morning, I guess it still is. As Governor Walz said, today really is a hopeful day, another hopeful day for Minnesotans. Very soon, more people are going to be eligible to get their vaccine and the deep peace of mind that can come with that. The 3 vaccines authorized in the United States right now really, truly are lifesavers. Each one of them will protect you against COVID-19 and, as the governor has said, help us get to the end of this pandemic together. I want you to know that you can be confident in these vaccines, and I'm sure Dr. Jacob will speak to this as well. When it's your turn, I hope you will get your shot. Getting vaccinated is safe, and it's highly effective at preventing especially severe cases of COVID-19. Every vaccine authorized for use right now has undergone rigorous and actually historically large clinical trials, testing their effectiveness and their safety. In these trials, all 3 of these vaccines were shown to have an extremely high rate of effectiveness in preventing severe illness, hospitalizations, and death. And while some people do experience side effects, hopefully quite mild and limited in time, immediately or within the next couple of days after getting their shot, these shots have been shown to be extremely safe for recipients. Getting vaccinated is going to get us back to doing the things that we love and the things that we have missed. I'm sure you noticed the good news that the Centers for Disease Control has put out guidance saying that fully vaccinated groups of people can get together indoors again. And we at the Minnesota Department of Health have, of course, adopted that guidance as well. That means families can share a meal, Minnesotans can visit their neighbors and friends, and grandparents can safely hug their grandchildren. These are the small, meaningful personal connections that COVID has taken from us, but we can get them back once we all get our shots. I just quickly want to also reinforce a very important point that the governor made about the fact that we are going to continue to prioritize vaccinating for impact and equity. So even though the eligibility will expand to include everyone above the age of 16 starting next Tuesday, we are going to continue to make sure that the people who are at greatest risk are at the head of the line, so to speak. The governor's analogy of those freeway lines moving is exactly right. We have explicitly directed our healthcare providers to be looking for their patients who are at higher risk, and we will continue to put special effort into those essential workforce sectors, as the governor mentioned as well. So just want everyone to understand that being eligible on Tuesday doesn't mean you're necessarily going to be getting your vaccine in these next few days, but we're all in line. And this is all about creating the flexibility so that as vaccine providers get through these next priority populations, they can move immediately and flexibly to provide the doses to any in their community who are ready and eager to take them. I would like to just share with you a really good success story here about how getting vaccinated protects yourself and your loved ones. And we've seen this. We talked yesterday on our briefing call, media briefing call, that every resident in assisted living or our skilled nursing facilities, and every caretaker in those settings, 2,000 long-term care settings in Minnesota, every resident, every caretaker has now had the opportunity to be fully vaccinated. Now, as we've seen really good uptake of these vaccines, particularly among residents, and it's growing among staff as well, what we've seen is that COVID-19 cases in these long-term care facilities have declined fully 96% from where they were in November and December, and COVID-19 deaths in that population have declined by 97%. And as a result of that, we've now been able to open up activities and visitation, returning quality of life to Minnesota's long-term care facilities, residents, and families. For residents to be able to safely see their families and go on outings outside of their residence into the community is life-changing. Hope is returning to these facilities after a very frightening and stressful year of coping with COVID-19. Simply put, these vaccines work. These data show how quickly they can work. And we can replicate this statewide in every population group if everybody gets the vaccine when they are able to do so. So I encourage all Minnesotans to take this life-saving opportunity, help yourself, help your family, help your community to recover and get us on the other side of this pandemic. With that, Governor, back to you.
Well, thank you, Commissioner Malcolm, and this slide is really powerful. That is what will happen in the general public if all of us get this vaccine. And we have that potential to do that very, very quickly now to be able to move through that. And I just want to, as I turn it over to someone we've leaned on for practical knowledge, for someone who's been involved in this, as we said, making these decisions based on the science and the practicality, I'm pleased to turn it over to Dr. Abe Jacobs of mHealth Fairview, who has been an incredible partner with us. Dr. Jacob.
Good morning, everyone. My name is Abe Jacob, Chief Quality Officer for mHealth Fairview. On a personal note, I want to say that just 2 months ago, I couldn't hug my 86-year-old dad or 82-year-old mom. Today I can. It is a remarkable story for all of us who have that privilege to be vaccinated. I want to really speak to our experience as a large health system. I think as Minnesotans, we can be proud that Minnesota ranks at the top or near the top in terms of percentages of vaccines administered that have been allocated. It is a remarkable accomplishment. Our health system, mHealth Fairview, has administered nearly 150,000 vaccines, first doses. It's been a remarkable effort. I want to personally thank our leadership, our frontline staff, our volunteers who've been all in this effort to end this pandemic. I couldn't be more proud to be a part of that group, really a part of all the health systems who've been a part of this effort. I want to speak to a few things about our experience in giving that many vaccines. Number one, as Commissioner Malcolm said, these vaccines are safe. They're very safe. We've been amazed at how we've seen a remarkably low level of adverse events, especially things that have required our people who've been vaccinated to have to go to the hospital. I mean, very, very, very small numbers. And so we're encouraged by that. What we've seen is that the hesitancy has gone down as a result of people hearing that news from their loved ones or their neighbors that they get vaccinated. They've done really well with it. Number two, these vaccines are effective. Again, when we started this effort, our first goal was to reduce deaths and reduce hospitalizations. And we've seen that in those who've been vaccinated. That's exactly what we've seen. In our hospitalized patients, the average age has shifted from the 60s down to the 50s. And frankly, that's because they haven't been vaccinated yet. When we do audits of people who are hospitalized, almost zero to barely very small numbers are in those who've been fully vaccinated. So that tells us that these vaccines are working. And again, as Commissioner Malcolm said, in our long-term care facilities and the Ebenezer facilities, we're seeing the same numbers that are reflected in the state. Those numbers are plummeting. It's given a lot of sense of safety for our healthcare workers and our residents who live in those facilities to again begin to get closer to normal again. And the last point I want to make is that just a point of caution. This is a race against the variants. What we have seen is an uptick in our hospitalizations in the last few weeks, and it tells us that we know that despite being vaccinated, there's a smaller chance that you can still get COVID. You're much more likely to be asymptomatic with it, but we know that there's still a possibility you can be infectious. And so we still want to have an abundance of caution until we get to herd immunity. We should still be wearing our masks. You know, we got to keep our social distance. We've just got to be careful because we know the variants is an issue, and we want to get people vaccinated as fast as we can. So again, my gratitude to you, Governor, to Commissioner Malcolm, for doing this as safely and as fast as we've been able to do it. Again, it's a great day in Minnesota that we can expand our vaccination tiers to include more Minnesotans. It's going to be a really good spring and an even better summer. Thank you.
Thanks, Dr. Jacob. Well, thank you, Dr. Jacob, and thank you again for all of our health providers who have stood on the front lines of this. This is the light at the end of the tunnel, Minnesota. This is the time we've been waiting for. This infrastructure that has been built, as Dr. Jacob said, is a testament to Minnesota's collaborative efforts, public-private partnerships, the ability to pivot as situations change, but always putting Minnesota's health at the forefront. And what we're seeing is those folks who measure these things independently outside, this was the method that needed to get us to this point. And now that deep, rich infrastructure is out there to be able to deliver vaccines. The vaccines are going to be coming in much greater numbers starting next week. And on Tuesday, here's what I'm going to need from you. I need your help, Minnesota. We beat this pandemic with you. We beat it by you going and getting the vaccine. If you've got a friend, a neighbor, a family member, they're not quite sure about this, and you're pretty certain they're not going to listen to me when I tell them to do it, maybe they'll listen to you. This is why talk to your friends. Get out there and make this conversation. Have this conversation with friends and neighbors and others to get them to get this done. We need to be, and I think we have the opportunity to be, first state in the country to get to 80% of our people vaccinated. Let's set those high goals. We've done it all along. We said we would care for the most vulnerable. We said we would keep as many people alive till we got to the end of this. We would try and reduce infections because we don't know what the long-term impacts are, and we would make sure that we were there to provide economic and other support to folks who felt the brunt of this. We've got a lot of work yet to do, but we've got the tools to beat it. So Minnesota, starting on Tuesday, get in that line, get registered, turn over whatever stone you need to and talk to everybody out there, but let's get vaccinated. Let's see the end of this. And I'm just, for all of you, we're within 2 weeks of the Twins opener. We've got a really bright summer ahead of us. We got some work to do together. Wear the mask, social distance, continue to test, and vaccinate. So thanks, Minnesota, and have a great weekend.